I had an interesting response to an email, well, one of the emails I sent out about this particular broadcast. We sent out several thousand, as you know, to people who have expressed an interest,
Sure.
GDPR and all that, in what we do. And I see it. We've got Stephen Barabas coming, and we're going to talk about lasers. And the message I got back was very terse. And I know the guy's not watching because he's not a member, but he just said, no, not for me, it's not osteopathy. And I just thought, okay, well, it's not necessarily something which was taught during my training as an osteopath, and I don't know what goes on at the AECC. But of course, actually, I wasn't being completely facetious in saying it's just concentrated sunlight, because it is concentrated light, isn't it? And actually, from what you've said, it is doing something to affect tissue healing, which would be very hard to achieve with our hands.
And drugs.
Yes.
And drugs. The majority of drugs you're dealing in pain management are blankets. They're local anesthetics, they're steroids. They are just trying to blanket out the pain. They're not actually
and
fundamentally...
opiates with very severe side effects.
Understood, and not trying to fundamentally go and improve the underlying core problem there,
yes.
whether it's a local or a central nervous system, where a laser has that capability, which is why it's such a great tool with chiropractors, osteos, physios, or manual therapists. And there's only so much you can do through manipulations of your hands or good exercise eccentric aspects. This really does add something. And what I enjoy vets, obviously, the general vet is a very omnicompetent sort of person where you're doing everything that comes through the door. What I like about working with chiros and physios and osteos is that they look more omnicompetent on the person. And, when you see an Achilles problem, they don't just look at the Achilles. They look at the whole structure of how the person's standing and they look at all other aspects of that individual rather than just concentrating on the Achilles tendon. And the laser is similar to that. If you just focus on just where the damage is, you're only seeing part of the whole problem there. You really need to look at the whole why has that happened
yes.
in their structure and things. And that's why I find it very compatible, and that's why I enjoy working with chiros and osteos, because of that philosophy.
There will be, I'm sure, a body within chiropractic and osteopathy who'd say, as you implied earlier, your own attitude, that's just another gimmick, it'll pass. And you've obviously found that's not the case in your own clinic. But is that the common objection you find, Stephen? Stephen?
Sorry.
Was that almost for you?
You were looking.
No, but you're the man who talks to more people about this sort of equipment. Is that a common objection, that they think it's just a gimmick?
I find that interesting when I've been to BCA meetings, when I've gone to the Institute of Osteopathy and to the physiotherapy first and all those sort of things. The older generation, it goes, my hands, that's all I need. My hands and my brain, that's all I want. And I find the younger generation is more accepting and more willing to take on new concepts. And to add that into an existing good training and a good philosophy in regards of how to approach the person, but in taking on things like ultrasound, like you said, and laser therapy, there is a little bit of a generation thing, not to put an aspersion on that.
Yeah, and I'm always fond of pointing out that actually no one could possibly be sure that the founder of osteopathy, Andrew Taylor Still, would not have used laser had he had the opportunity, but he didn't.
Understood.
There is a well-known tenet in osteopathy, probably similar in chiropractic, the rule of the artery is supreme. And you've talked an awful lot about blood perfusion and stimulating circulation and improving oxygen distribution, all that sort of stuff, all of which sounds as though it's in keeping with what we're trying to do to the body.
Yeah.
And I have a personal view that we're not here simply to adhere to the original principles of our founders. We're here to make patients better. So if there is a role in anything that comes across our radar, then perhaps we should be looking at it.